Assalamu alaikum and very good day, everyone. My name is Belal and I'll be presenting about the prostate cancer. So what is prostate? Prostate is a small pin-shaped gland in the pelvis of the male reproductive system, which is responsible for the production of the semen, and it is located, as you see here, in front of the rectum, inferior to the bladder and superior to the end of the penis. So what is prostate cancer? It is a tumor of the prostate gland, which happens when the cells grow out of control within the prostate. It is very crucial for all males because it is the most prevalent in old men over 50 years. So for the symptoms, problems in urination, observation of blood in semen and urine, reduction in appetite, loss of weight, weak urine flow, painful ejaculation. For the risk factors, history of family, Black or African American men, age, obesity, transmitted disease from sex, diet and lifestyle. How to diagnose? Through the first primitive one is the prostate-specific antigen, which helps to detect the cancer, show if the treatment is working or not, also show how fast the cancer is growing. Also, monitoring the PSA level over several months can help the doctor if you need another or further treatment. Second is the digital rectal exam, which used to see if you might have any prostate problems or prostate cancer, and can be felt by inserting a covered lubricated finger into the rectum. Third is the biopsy, involves using the thin needles to take small samples of the tissue and then could be looked under the microscope. For the imaging, the first one is the transrectal ultrasound, which sends sound waves through the wall of the rectum and into the prostate and surrounding tissue to create images of the prostate. The second is the CT, a 3D images computed tomography to see if the cancer has spread to lymph nodes and surrounding tissues for more details. The MRI, the best resolution imaging of soft tissue among other modalities, which uses magnetic field, radio waves, and computer to produce the complete images and measures the tumor size. The PET, a very advanced nuclear imaging technique which combines the CT and the PET into a single machine. Also, radioactive substance is administered intravenously into the body of the patient. The substance is absorbed by cells which use energy or biologically active, and then the cancer becomes biologically active. Hence, the substance is absorbed by the tissue, and the scanner can detect the source of the scan of this cancer, and producing many images of the inside of the body. The last one is the bone scan imaging test that uses a small amount of radiation in case you have a bone pain or if the doctor thinks the cancer has spread to surrounding tissues. For the staging, the first and the second stage, tumor is only found within the prostate gland and it is called localized cancer. The third is the locally advanced cancer, where the spread is only to the nearby tissues. And the fourth one is the metastatic, spread to a distant location such as lymph nodes, bones, lungs, and so on and so forth. For the treatment, through surgery, remove the prostate and surrounding tissues. Hormonal therapy, stop or block the production of testosterone because cancer is dependent on that. Chemotherapy is the advanced castration-resistant prostate cancer, which kills the DNA of the cells of the cancer. Radiation therapy is the high energy rays are projected on the patient body to kill the cancer. For the protection and safety, radiation and radioactive substances are very beneficial in the use of medicine. They also shed some risks if not managed and delivered professionally. So here are some points that need to be considered. The first is the duration of radiation exposure. The second, there should be some distance between the patient and the source. The third is the projection, should be the projection only on the imaged organ. And finally, we should reduce the number of images, for example, from 30 high resolution to 9, for example, good resolution. For the weaknesses and improvement, ultrasound weakness is limited tissue contrast and the improvement is to enhancement of contrast harmonic for a better visualization. And the PET weakness is technological attenuation correction, and the improvement correction of these artifacts. For the multi-parametric MRI, the problem is, or the weakness, real-time imaging, and the improvement is development for an alternative input options. For the CT scan, weakness is the visualization of morphological and anatomic structures, and the improvement is improved soft tissue contrast detection of lesion and staging of cancer. By that, thank you.